Hi, I'm Dr. Anju Methil, a dermatologist. Welcome to Nykaa's Mom and Baby Special. Today I'm going to be talking about skincare in new moms as well as in babies. I'm going to give you simple pointers how you can take care of your skin without spending much time on it. One, you definitely have to cleanse in your face. A simple thing what you can do is you can use a micellar water. It has small particles like micellar which will attract the dirt and remove the dirt and grime from your face. Second, you definitely have to moisturize your skin, whether it is a dry, combination or oily type. You can use the water-based moisturizers, and sometimes you get a post-pregnancy pigmentation because of the hormonal changes. So what you can do is you can use a sunscreen which has an additional moisturizer with it. Thirdly, be sure to use a night cream. It can be a simple moisturizing cream containing a hyaluronic acid which will enable your skin and hydrate your skin. Last but not the least, keep a mist close by to you, so whenever you feel like your skin is not feeling too good, it can have a refreshing effect on you. As far as the baby skin is concerned, the mantra is less is more. Babies, when they're newly born, have a caseous material on them which is known as vertex. It's actually a protective material. So you don't need to rub it off or scrub it off because that will cause damage to your baby's skin. It'll go off on its own when you're giving a bath to your baby, and it generally takes around a week to a fortnight for it to go off. Also, when you're giving a bath, take cupfuls of water and put it on the shoulder of the baby instead of putting it directly on the head, because you wouldn't want your baby to come up with a cold. After you remove your baby, you give a shower to the baby and probably use mild products which are meant for baby, which are baby specific. Don't use adult products because your skin is sensitive. Many a time you might find babies getting diaper rash and eczema. In fact, atopic dermatitis is very common in babies, but it resolves on its own when the baby reaches around 9 years. So all you have to do for these babies is moisturize very well and use a very mild cleanser when you're giving a shower to the baby. Today we're going to have a new mom come in to ask a few questions. How old is your baby?
My baby is 5 months.
Okay.
And basically I had a few questions to clear my doubts. So one of the questions was, why do pregnant women get itching in the second and third trimester of pregnancy?
There's a lot of hormonal changes which is occurring in the body because of pregnancy, and because of which there is sometimes just a itchy feeling, or sometimes you may get rash on your tummy which can spread beyond also. You can probably just use an anti-allergic or use a calamine lotion which can help you with that.
Another question, what is the role of malish or massage, for babies? I don't understand why people are so.
So what I generally say is that do malish, but do it in winter months because it helps in getting warmth to your baby. And also whatever you use for a malish, use something mild. Like you can use a moisturizer. So when you're using a moisturizer, it is also hydrating the skin. So that's the benefit of malish. Beyond that, no. I definitely don't recommend it during summer months because sometimes your babies get small red color prickly heat rashes because of malish and that. So you have to be careful in that. It all depends upon how well your baby can take it. So now we're going to have our lactation expert, Ms. Aloka Gambhir.
Hi, I'm Aloka. I'm going to be talking to you a little bit about breastfeeding and lactation and the early days of being a new parent. So everything to do with the way human milk is made to the baby's reflexes just shouts out for the baby to keep being picked up again and again to be soothed. They need a caregiver to soothe all the time, and the baby does need to be put to breast very often, and that is something a lot of new mothers are not aware of. Most babies do want to be carried a lot in the initial few months, and for that, to carry a baby all the time in arms, you can do that if you have a lot of people to hold your baby, or you can use a sling where the baby remains near you. I'm going to just ask for a couple of baby carriers just to show you what I'm talking about. This is what is called a stretchy wrap. It takes the shape of my body as well as the baby, and it's really ideal for keeping newborns really close to you. Many of these carriers you can feed, you can nurse in them, and let the baby sleep after nursing, so they're pretty handy that way. So I made a cross at the back, cross in the front, and that's it. And I'm just gonna put him in right here near my heart. It's called a heart-to-heart carry. I'm going to put it all over his back, get his other leg this way and put it all over. So there, he's already in. He can nap in this if he wants, and I'm just going to get his legs through here. This is, for naps and for nursing as well. This is really a great cover. And I'd like to ask Kanchan to join us. She's a mom and she has some questions that she'd like addressed.
I'm really curious that after, once I feed the baby and I put the baby down, my baby wakes up really often. So could you give me some intake on it?
Yeah, babies actually are not meant to sleep as much as, for as longer gaps as we think they are. And that's, breast milk is designed to make sure that the baby comes back to you and stays as close to you, which is imperative for a baby's survival. It's designed to be, something that they digest really fast and wake up and want to come back.
Also, I'd like to ask about one of the most common thing we all new mom go through. When we breastfeed, it really gets sore, and it's really difficult for us to, even go through the pain of, breastfeeding and also the breast pump, and, a lot is going on. So what could we do that would help us as well as the baby, to get over it as soon as we can, to relieve the pain?
What I would say is definitely if it's really painful, then get help with the latch. Meet a lactation expert or someone who can help you correct the latch, because if the baby is latched onto the areola, not the nipple, in most cases it's not painful unless there's a tongue tie or some other issues. So yes, a pain is an indicator that something's not right. Then other than that, I think there are some products that are available with Medela, which are for applying on the nipple. They're lanolin creams. I have some breast pumps here from Medela. They have different functions. So this one, for example, is a double breast pump, and it's great for a mother who's planning to go back to work to invest in, because she can just within a week or even 10 days can get a supply, get milk stored in breast milk bags, which also which also Medela sells, and just store in the freezer and let whoever's taking care of the baby give the baby that milk while she's away. So Kanchan, I hope I've answered all your questions and you've had a nice session.
Yes, definitely. Thank you so much.
Thank you for tuning in to Nyka's very first mom and baby special. We've had a really good time. We hope you had a good time too.